And the assessments were made. You would say that here the people were coming in annually, got a $100 honorarium. And what other kind of things were being done at those assessments?
Well, since our focus is all clearly on height and weight, we got their height and weight. We measured their blood pressure. We did blood work after a 12-hour fast and used standardized laboratory procedures to analyze cholesterol, triglycerides, hemoglobin A1C. They also brought in all of their prescription medications for us to review, so we knew exactly what they were taking.
Good.
One of the more interesting things that we did was we did do a treadmill exercise test. And you had mentioned we had done one at baseline, and we did one again at years 1 and year 4, where we were doing submax tests and could look at the changes in fitness between the beginning and years 1 and 4.
So people did get a chance to get some exercise in, which I think is a really interesting part of your study. Okay, so let's take a look at some results now. Eventually, 5,145 patients were randomized. You have two good groups there, almost the same number, 2,570 and 2,575 in the two different groups. Baseline characteristics are pretty, the way I look at this is pretty much what I see in clinic. A little bit more than half are women. About 37% were from different racial and ethnic minorities. 14% already had a history of cardiovascular disease, which is quite interesting, and that's very typical, too, of diabetics. Mean BMI, look at that, or the average BMI, I should say, was 36. So you did have a rather stout group. Obviously, these people could lose weight if they try, and they've got a ways to go, so it'd be kind of interesting to see what happens. And you had a very good completion at your four-year point. 93% of your participants continued in the study.
I think it's clear, but I just want to make sure everyone realizes that participants in this trial could not pick which group they were in.
Right.
They were assigned by chance to either receive the intensive lifestyle intervention or the diabetes support and education program. And that's very critical in any randomized trial, that you assign the people to those groups by chance.
Right, random, that's great. So let's see now, with the other ones, the cumulative effects averaged across 4 years. Now, we're going to be talking about those since the intensive lifestyle group experienced greater improvements in weight. Well, why don't you tell us about that, what you see there in the slides there. Give us your opinion of that. I've got a question to ask you afterwards, but let's see what...
Okay, so what we're looking at here, and I don't know if you want to go right onto the table, that might be even easier for people to look at from the table, but what we did was we looked at our results by saying, let's look across the 4 years of the study thus far and see on average across the 4 years, how did the two groups do? And in terms of, let's say, weight, the intensive lifestyle group had lost about 6% of their body weight compared to about less than 1% of their body weight in the diabetes support and education group. Our participants came in weighing about 100 kilograms. So actually, these numbers would be very, very similar if I did it in kilograms. It's about 6 kilograms versus about 1 kilogram. Now, this looks at the results across the 4 years averaged. If those who are on the audience would like more information about this study, we actually present the data looking at year 1, 2, 3, and 4. And for example, with weight, the biggest difference between the two groups was at year 1. The groups remained significantly different from each other at year 4, but they were further apart. As you might expect, we got bigger initial weight losses, and then there was some regain in the intensive lifestyle intervention. But what we're showing here is that averaged across the 4 years, the intensive lifestyle intervention had better improvements in weight. If you go down to the next line, they had better improvements in their fitness. That's percent changes in their METS level during the fitness test. They had better long-term, average across the 4 years again, better improvements in their hemoglobin A1, their systolic blood pressure, their diastolic blood pressure, their HDL cholesterol. That's the good cholesterol. You'd like it to be going up, and it was going up more so in the intensive lifestyle intervention. Triglycerides were coming down more so in the intensive lifestyle intervention, averaged across the 4 years. So all of those changes favored the intensive lifestyle intervention. LDL cholesterol is the most interesting one, because if we don't adjust for medication change, if anything, the diabetes support and education group actually had greater improvements in their LDL cholesterol. they came down 12 milligrams per deciliter in the DSE group compared to only 11 in the intensive lifestyle intervention. But if you adjust for changes in the medication, which we'll go on and show you more medication change data in a minute, if you adjust for that, both groups had comparable reductions in their LDL cholesterol.
Excellent. So what we could see is that it turns out diet and exercise work is what you're getting to. But it's got to be done in an intensive manner with a lot of intervention with people, but interventions that are quite possible to do.
And works over 4 years, is sustained for 4 years.
Right. Now, the next slide I've already put up, medication use, which is kind of interesting. As you pointed out, it was the physicians taking care of the patients that were adjusting the medications. You weren't able to do it and say lower somebody's medicine or so on, but it did still make a difference as to what happened with medication use.
Yes.
So tell us about that as far as blood pressure.
Again, I think it's easier if we go to the next slide where people can look at the numbers.
Okay, let's go there.
This slide can be a little confusing to people, so let me walk you through it. Over on the left of the slide are the people who were not using a specific type of medication at baseline. And over on the right is going to be those who were using it at baseline. So let's take the diabetes medication. At the beginning of the study, only 354 people in the intensive lifestyle intervention were not using any type of diabetes medication, neither insulin nor oral medication.
Right.
And
so
only
those are the patients who are diet controlled.
Now, at 1 year and at 4 years, a greater percentage of people in the diabetes support and education who had not been using those medications had to start on those medications. So of the people not using it in DSE, about a third start within the first year, and 2/3 have started by the 4th year. Okay. Now, if you go across to the next part where it says continued use from baseline, this looks at the 2,000 plus individuals in intensive lifestyle intervention who were using medication at the beginning for their blood sugar compared to the 2,000 in DSE. And you can see here that at 1 year and 4 years, the physicians had removed more people who were taking these medications from their medication at 1 year and 4 years. So intensive lifestyle intervention had two effects for medication use in terms of diabetes medication. It led to fewer people getting started on the medications and more people being taken off the medications.
So, and that goes into every one of those categories, insulin, hypertension, and, now lipid-lowering medicines were a little bit different. Lipid-lowering medicines were different. And I think one of the things you mentioned in the paper is that there was kind of I hate to say a secular trend, but there was a trend across the country to use more lipid-lowering agents kind of across the board.
Absolutely. And particularly in the diabetes support and education group.
Yes, and I think that's something that goes along with a lot of things that have been going on. People have been told control lipid. It is very important, but it's very interesting. I know as a physician, it's very important to keep people under good control. And I think with the least amount of medicines as far as difficulty goes, starting someone on insulin. Insulin's a great medicine. I've used it a lot. But it's a lot easier if you don't have to, and one of the things you're showing there is there is clearly a statistical difference if a person is in the intensive lifestyle intervention group with their starting insulin or not, and other hypertension medicines. So right. I think what we're seeing there is that things do work, and it's kind of, there's several ways of looking at it. When you first look at maybe the changes in hemoglobin A1C, you might say, well, they're not too much different between them. But the important point is here, you're getting good control with fewer medicines, therefore fewer side effects, fewer expenses, and other kind of problems that we're obviating there. So it's very beneficial.